Today we're going to be talking about herniated lumbar discs and lumbar radiculopathy. I'm very happy to have Erica Sloan here with us today, who in fact did suffer from a herniated lumbar disc and a lumbar radiculopathy, and I'm pleased to say has recovered from it. So Erica, thanks so much for being here with us.
Delighted to be here. Can
you talk about how you discovered that you had a herniated lumbar disc, what your symptoms were originally?
Absolutely. It was July of, I guess, 2011, and we went jet skiing, and I'd never been jet skiing before. And soon after jet skiing, maybe a couple hours after that, I had back pain like I'd never had before.
Did you hit any big waves? Did you slam that
Probably,
jet ski a bit?
Probably, yeah. And, you know, I was trying to be cautious, but there was a lot of just kind of up and down. There was a lot of
when
wave.
you're on a jet ski and you're going full throttle, it's hard not to have some pounding.
Yeah. And so a few hours after that, I had pretty excruciating back pain. And I didn't really know at that point what was wrong, but the pain got better, you know, after maybe 6 weeks. But
so what did you do during those 6 weeks when you had
well,
that
I went to
back
my
pain?
doctor. I went to my general doctor. And she at the time said, oh, you probably just bruised it and it'll get better.
So she thought that you had pulled a muscle, you had a lumbar sprain, or maybe you'd even caused inflammation of the disc, or possibly even a bruise in the bone.
Yeah, yeah. I mean, she didn't recommend that I do anything about it at the time.
She didn't suggest any anti-inflammatory medications? Or
ibuprofen, you know, Advil.
So that's a non-steroidal anti-inflammatory medication that can be very helpful in reducing inflammatory reactions.
It was that first day, you know, a few hours after, and actually that whole week and probably even weeks afterwards, I had to take, I don't even know how many Advil or ibuprofen, a lot.
It did help.
A lot. It helped, but after many, too many, which should have been an indication at the time that something was really wrong. But I'd never had a back problem before, so I really didn't know that that was an indication of a problem. And it got slightly better.
And you kept working.
Yes, I kept
exercising,
going. Working, everything, not knowing that there was really a problem. A lot of times when I would stand up from sitting, I would be hunched over, and it would take me, you know, a minute or so before I could fully stand up straight. At the time, I didn't know that that was a sign of a herniated disc, but I've since been told that that's sort of the sign of...
one of the signs.
One of the signs of herniated disc.
So after the 6 weeks, what began to happen?
There was still pain. There was definitely still pain. It was better, but there was still some pain, especially when I stood up. It was manageable. There was definitely still a lot of pain. It was, I want to say December or January, so months afterwards, that I went back to my doctor, and she referred me to physical therapy.
Because the pain was still there.
It was still there.
Fully resolved.
Yeah. And at that time at certain points had maybe gotten a little worse. And physical therapy, after a couple weeks, there was one time when, you know, I was on the physical therapy table, and the physical therapist was kind of, you know, touching my lower back. Does this hurt? Does this hurt? Does this hurt? And at one point, he touched something or did something. I jumped off of that table so fast. I said, please don't do that. That was excruciatingly painful. Please don't do that.
Was it all in the back, or at that point had it gone into the leg as well?
At that point, it was still pretty much my lower back. It was after that point that then, because people had asked me, oh, do you feel tingling in your leg at all? And I, at the time, was like, no, I don't have any of that. But soon thereafter, I did start to feel that. And
did it start to come on gradually? It wasn't a sudden, wow, my leg hurts.
It did come on kind of gradually. It was gradual. It was like a tingling kind of numbness.
Because it is not uncommon that when a disc herniates initially, the symptoms aren't that profound. Mm-hmm. It sounds like what happened with you was that when you had that jet skiing trauma, it damaged the disc. The disc has a very tenuous blood supply. The blood comes from the bone at the end plates of the disc, and that's how the disc gets nourished. If those vessels are traumatized, you're not getting the kind of nourishment the disc needs. Plus, you can disrupt some of the fibers in the disc, which weakens the disc. So it can give you pain, and it can change the dynamics of the disc, so the disc is more prone to herniate. And then, when it starts to herniate, you can start to get the symptoms of nerve compression like you were getting before the pain in the leg becomes excruciating. So you started with these symptoms that were relatively mild, except for when the physical therapist did that maneuver, which probably caused some mechanical movement of the disc. When we're normally moving around, the pressures on a disc are very high. And so one little movement that can cause the muscles to contract can then cause a marked buildup of pressure in the disc and can then force it to herniate, like if you push a tube of toothpaste. And it can squeeze out the wrong side.
Yeah.
So the purpose of the physical therapy is to reduce the inflammation, to strengthen the muscles. But if there's a damaged disc that's herniating, then physical therapy can't really rectify that. So then what did you start to notice? When did it start to get really bad in the leg so you felt you really needed something more done?
Well, there was probably soon after that, it kind of came on, it did come on gradually, kind of the tingling and numbness in my leg. It was mostly the pain in my lower back, and then it just persisted. The pain persisted. Physical therapy really wasn't, I really couldn't say definitively that it was helping. And I called my doctor and I said, and just after talking to other people, I said, I really think I need an MRI. I really think we need to. There was one day actually that I do recall when I woke up in very excruciating pain. I couldn't get out of bed. I just couldn't. I called in sick to work, and my bosses and
it was really affecting your life at this point.
Oh yeah, and it was affecting my life before then, but this one particular day I just couldn't move. It didn't, and because even before that day I was on my doctor had given me painkillers and muscle relaxers.
So at this point you really were taking some
pain.
heavy duty medication.
I was in pain, yeah. But that one day in particular, I knew. I said to my husband, something is pretty wrong. I'll be shocked if I have an
So
MRI.
the more substantial pain was in your back, and you felt this tingling and numbness in your leg.
Yep.
Did you ever get to a point where the leg pain became profound?
Not really. It was more the back pain that was...
Because people tend to think that you only have a herniated disc if you have what's referred to as sciatica, with severe pain in the leg. But that isn't always the case, as in your case. Sometimes the back pain can be the more severe pain because the nerve also goes to the muscles in the back as well as the muscles in the leg. So when that component of the nerve is more compressed and irritated, you're going to get these severe spasms in the back that can give you excruciating back pain. And it's very individualized. Some patients, the leg pain isn't as profound.
Yeah.
In others, of course, the leg pain is the
That's
profound
interesting.
symptom.
I didn't even actually know that. Yeah, my leg pain wasn't. It was more a little numb, and there was some pain, but really the majority of the pain was just my lower back.
So once you had the MRI and it was seen that you had a large disc herniation, at that point you felt, I don't want to keep living with this.
Well, my doctor called me and said, you have to see a neurologist today.
So you came to our office.
Yeah.
And I point out that you had a herniated extruded disc fragment, meaning a piece of the disc had actually come out of the confines of the disc and was pressing on the nerve. And at that point, because you hadn't gotten better, it had been several months, I recommended surgery to you. How did you feel about that?
I don't know if you remember, but I had a panic attack here, and I was laying down on the couch here in your office for a few minutes. But,
it's, of course, not uncommon.
Yeah.
For people to fear spine surgery.
Yeah. But it was a relief knowing what the problem was, because I was in such excruciating pain that I knew there was some problem. And right when you showed us the MRI, when we were looking at the MRI, it was evident that there was something.
A picture's worth 1,000 words, so to speak. It's pretty clear once it's been shown to you.
Yeah, that something was really wrong.
So I recommended to you what I refer to as an endoscopic microdiscectomy, which means that we go through a very small incision and through a tube, basically, go into the spine through a very small opening in the spine and pluck out that disc fragment. We did that, and you were brave, came into the hospital, got there, but at that point, I think you felt that there was no option anyway.
Yeah.
You didn't want to live like this. You went home the same day, right?
I did.
So how did you feel when you woke up?
I felt okay. I felt, you know, the nurses said if you can walk, we can, you know, let you go home today. And I was able to get up and walk. And
could you tell there was a difference in the pain level?
Yeah. I think right away, I think actually there was, you know, I mean, I was on some medication right after the surgery, but, you know.
Yeah, you're a little groggy.
A little groggy right after surgery. But
and
even, I mean, you know, the next day, the following days, yeah, absolutely. And I really was not on that much pain. I was on more pain medication, you know, certainly before the surgery.
How long would you say it took you before you felt like this really has worked and I really can get back to a normal life again?
I guess a matter of weeks. I mean, it really wasn't very long before, you know, I was fine again, you know, going back to work, going to, I mean, it was, you know, I think I was erred on the side of caution and kind of, you know, maybe took an extra week or two
Which
off.
is better to do than the reverse, because you want to have things heal well.
Exactly.
So that it minimizes the risk of a reherniation, which is about 15%. But when you do what you've done, which is to do the physical therapy to strengthen your core, stay in good shape, then the likelihood of a reherniation becomes very small. And hopefully that was it for you and spine surgery.
Yes, hopefully.
I'm very happy that you're doing so well, Erica.
Thank you.
Thanks
I owe
very
everything
much.
to you, so.
Oh, you're most welcome. Thanks so much for coming and sharing your experiences with us. And thank you all for joining us for this segment regarding surgery of the lumbar spine. I'm Dr. Ezriel Kornel, and hope that you watch some of our other educational videos.